Thank you for listening to Raising Me. I'm Adrienne Stein. Of course, winter can feel extra long, especially when seasonal affective disorder or SAD strikes. It doesn't just affect adults either, kids and teens too. In this episode, longtime family therapist and director of MaineHealth Center for Trauma, Resilience, and Innovation, Rebecca Hoffmann, talks about how to spot the signs of SAD, what you can do to help, and how small changes can make a very big difference for your family this season. Check it out.
Rebecca, thank you so much for being here. Always appreciate it. Let's just start with the basics when we're talking about SAD or seasonal affective disorder.
Mm-hmm.
What exactly is it, and how is it different than, other types of depression?
Sure. So seasonal affective disorder is really a type of depression that's involved in the change of seasons. So that's the trigger for it. So it comes and goes with the change of seasons. And interestingly, most people associate it with winter, right?
Mm-hmm.
But there is a summer seasonal affective disorder too that some people do get from the shift to spring, summer instead of what we hear about fall, winter.
Oh, interesting. So there's a little misconception there. I also will say, maybe this is a misconception on my part. I always sort of assumed it was more something that adults experienced and not so much kids, but in doing some research on it, it does impact kids and teenagers.
Mm-hmm.
What might be some of the common signs or symptoms that we as parents can look for when it comes to SAD
Mm-hmm.
in our kids?
Just a couple of things. It's most common in young adults. So that transition age youth where there's already a lot of, stress, change in their
Mm-hmm.
lives, is an age where sometimes it will begin. And it doesn't happen every year for a person, let's say.
And when you say young adults, 18 to 20s, early 20s, like kind of that transition.
Yep.
Okay.
Transition age. And more often in women than in men. And so in terms of what to look for, really the signs of depression are very similar in a typical depression or seasonal affective disorder. So one of the biggest ones is sleeping, like sleeping more and more. So for example, one of the things that they think might trigger or make seasonal affective disorder worse is that the chemical melatonin, which people may have heard of sometimes, you can take melatonin to help you sleep. It's an over-the-counter remedy. It's also a chemical in our bodies. And when it's dark out, that's what triggers our body to release melatonin. So when we have shorter days and more dark, our body starts releasing more melatonin, which can be part of seasonal affective disorder and the reason why people are very tired, withdrawn, grumpy, loss of appetite, just sort of a muted or darker outlook on the world, things like that you would see in any other type of depression.
I also have seen that in teenagers also. So it is kind of trying to figure out what is, typical teenage kind of changing of bodies and hormones and all the
Sure.
things. And then also how it could differ from seasonal affective disorder.
Right. So the same chemicals that are shifting around in the bodies of teenagers are the same chemicals involved in something like seasonal affective disorder, like serotonin, right?
Mhm.
Serotonin is a really important chemical for happiness or sort of lack of depression. And it looks as though, although the researchers don't know the cause of seasonal affective disorder, serotonin seems to be involved in it. So a lack of serotonin, a reduction in serotonin. And so that's also what's involved in regular depression. It's also, one of the many chemicals that's shifting when kids are going through puberty and
Mhm.
changing. And so what I would say most importantly is you're looking for a change in normal behavior. What's normal for that person? So if you have a child that is up at 6 every day and they start to really need to sleep more, that might be a sign that they're being affected by something like seasonal affective disorder. It could also be a sign that they're becoming the type of teenager that sleeps late, which is also part of it. But it's just, you're looking for sort of a cluster of symptoms that might, not just one, but a cluster of symptoms that is a shift in their behavior.
Okay. So, I also think about like just the tension that can cause within a family when, teenagers are sleeping or, acting different or the moodiness. So as parents, like I seems particularly important to be hyper aware of this as a potential reason because it seems like this could impact family dynamics in a pretty big way.
Absolutely.
How so?
Absolutely. Really, there is this sort of homeostasis or, kind of normal dance that a family plays, right? People each have their role in a family, right? You have one that's sort of maybe the one that likes to get in trouble, and you have another one that's kind of the little adult, maybe. There's all these
Sure.
different random roles that kids play based on their personality and the family dynamics. And so when someone shifts from that normal behavior, it can upset that family dynamic where your, let's say, most lively, fun child is not so fun and lively anymore. And so that kind of changes the whole dance,
Sure.
right?
Absolutely.
Right.
I just think in terms of risk factors too. Depression, there can be family risk factors. Is it the same with seasonal affective disorder? Can we talk about some of the risk factors to be
Yes.
aware of?
Yes. So a history of depression, seasonal affective disorder, or bipolar disorder in a blood relative can be a risk factor. Interesting, living further away from the equator.
So like northern climates,
Right,
as we
right,
speak
right.
to you from Maine, in the
Exactly.
middle
Yes.
of winter.
Yes. So,
So daylight hours is a big one, and I mean, we're in an area where we're getting dark at 4:30. It's dark. It's hard.
it is hard, and it's
Mhm.
also cold out. And
Yeah.
so sun is really important in the treatment of seasonal affective disorder. But when it's cold out, we don't necessarily want to go outside, and it's icy. We don't want to go for a long walk. So
Right.
the things that can help us actually are harder to do. In addition, one of the things being in the sun does is releases vitamin D in our bodies, which is also part of a risk factor with seasonal affective disorder is a low level of vitamin D, which is what you get from being out in the sun. So that's another place where that light is very important for the release of vitamin D.
And you talked a little bit about like going for a walk and things that we can do to alleviate symptoms. Let's talk a little bit about that more. Like, okay, so we see these signs,
Right.
whether it's, frankly, in our teenagers or children or ourselves. What are some of the things that we can do as parents to help alleviate some of the symptoms of SAD?
Let's start with just sort of what, like you said, what parents can do
Mhm.
versus going into kind of more medically involved interventions. First off, I just always say that is to see the doctor, have them see the doctor, because although there might not at that point be some sort of a medical intervention, it's always a good place to start when you see a shift in your child's behavior or their mood. And so, with that being said, some home remedies would involve, one of the biggest ones is light. So bringing light, and people have probably seen there are specific types of light. So it's not just the light of a lamp. Specific types of light can be helpful in seasonal affective disorder. So just having these specific types of lights available and turning them on a little bit can dramatically impact, because it brings out that vitamin D again and reduces the melatonin from creeping in.
So those really do work. Okay.
Those are
Is
firmly
there like a
reversed.
pro tip on how to select one or find one? Like you said, it's not just like a lamp
Right.
that we have in the living room. This is a very specific type of light.
Yes. What I would say is for any consumers to do a little research and make sure that the light is one that specifically treats seasonal
Got
seasonal
it.
affective disorder. So make
Okay.
sure it's one that specifically does that, says that, and has certain kinds of rays that are going to actually impact that.
Do you need to turn it on at when it's dark out to extend the daylight, or really just having it on any time of day?
Having it on any time of
Okay.
day is fine, because if you think about when you're sitting inside, even if you're
Yeah,
near a
right.
window,
No, of
you're not.
course.
And right now in Maine, the sun is far away. We're far from the equator. So even if you're near a window, you're not getting intense rays of sun. So anytime putting on one of those lights can have a huge benefit.
Does diet impact uh, SAD in any way? I mean, I would think exercise would certainly be helpful, but
Yes.
does diet also?
Yes, both diet and exercise are important. When we think about really those sort of home remedies, one of the important things to think about is what helps when you feel sad in general. What are the home treatments for depression or something, subclinical of depression? And we would say healthy eating, not just because it's better for you, it feels better in your body, but it's food as medicine, right? Healthy food actually really impacts your body's chemicals. And processed food also impacts your body's chemicals in a negative way. So really making sure you're eating healthy and getting outside even for a walk if it's safe, right? So releasing those endorphins, sort of getting sweating that stress out of the body can really, really help.
Food is medicine. Very, very good point. Though at the same time, when you're feeling bad, all you want to do is open a bag of Doritos.
Absolutely.
It's so hard
Right.
to do
All
that.
in
So
moderation,
right,
right? That's
exactly.
what we always say. Anything in moderation.
What though is sort of that trigger point where it's like, we've tried these things at home. Nothing is really getting through. When do we say, okay, this is bigger than us. We need some help here.
Sure. So what I would say, and I have, being a mental health practitioner, I have a pretty low threshold for when I would seek help for a family member or one of my children, just because it certainly doesn't hurt to get the opinion of an expert.
Yeah.
We know our kids best, but we also have some blinders on sometimes because we know them so well. We might miss some things. If the home remedies are not working, or you're seeing some severe signs of depression or suicidality, for example, you would immediately want to get connected to a provider. There are treatments, medicines, a lot of the treatments, again, for depression that can also be very effective in seasonal affective disorder. So I would say keep a low threshold for seeking help, at least a professional opinion on, is this seasonal affective disorder? And if so, is it at the level that we need to get some further help, or can we treat this at home?
And you mentioned there are some medications that can help, but what are the other types of treatment? What does it look like to get treatment for SAD?
So treatment, one of the treatments is therapy.
Yeah.
There are types of therapy that are like cognitive behavioral therapy that are pretty common. Most all therapists are trained in the treating of depression or anxiety, which there is sometimes people that experience more of sort of an anxious form of seasonal affective disorder. It's like sort of like an agitation that actually is more common with the summer version. But therapy can be a very big help in really providing some buffers, tools in the toolkit to support someone. And those tools that a therapist or therapy provides that go into that person's toolkit, they then carry into the next year when this might happen again, or the year after that. So they can really be beneficial long term.
It's a lot of learning. I also wonder about approaching the subject with we seem to be talking more in terms of teenagers because they're more likely to experience this, but so that they don't feel stigmatized, so it doesn't feel like you're so moody,
Mhm.
like really creating conversation, a helpful conversation around it so that, our kids are more open to being proactive in whatever that looks like, whether it's help at home or going into a therapy situation.
Right, right. I think you have a great point, sort of normalizing the conversation.
Yeah.
And also, I find that normalizing that the shift in seasons is very hard on our bodies. Any season
Mm.
is really chemically it's difficult for the body to transition from, let's say, fall to winter or even winter to spring. And so normalizing a little bit that our bodies are adjusting to a different season, different amount of light, different temperature. And along with that struggle that our body is kind of naturally going through, sometimes some of us get more impacted by a change in season than others, but it is a very normal, common thing.
Is there any way to prevent it before even happening?
That's a very good question. I think yes. So I believe there is ways to prevent it. And primarily what I would say, and what I will just as a disclaimer, what I will
Hmm.
say is I'm not a medical doctor, I'm a therapist. And so this would be something I would want someone to talk with a medical doctor about.
Hmm.
But the ways that, let's say you had it the year before, that you treated seasonal affective disorder the year before, if you started those things early, so let's say the light therapy, really finding ways to get outside, maybe using some of the tools in your sort of emotional toolkit you developed in therapy, you could very well prevent the symptoms. It still might be sort of your body might have some of those same chemical reactions. But for example, there are medications for depression, many that are very effective, and some types of those medications impact serotonin and the reuptake of serotonin in the brain. And so that positively impacts depression. It would also, if somebody were on one of those medications, for whatever reason, that could positively impact the development of seasonal affective disorder because they're already treating the chemical
Right.
shift.
No, that makes perfect sense. And I know we're talking about this in the larger context of kids and as parents, but all these things I'm thinking of in terms of parents are experiencing these things too. And if
Mhm.
we're feeling like this impacts the way that we show up for our kids and
Absolutely.
our families.
Mhm. Right. So I think for any parent who's listening, we all know what that's like to lack energy in the
Yeah.
winter
Yes.
or anytime, but in the winter when it's dark
In
at
particular, of
4:30
course.
and it's dark when you wake up in the morning, that is really hard to
Yeah.
kind of keep that engine
Keep on going.
running. Yes.
Sure.
So be really sensitive to that, right? That it's not something wrong with you as a parent. Your body's adjusting to the shift in a
Hmm.
season, and that's really hard on the body. And so we need to take extra care to help ourselves through that adjustment.
Just giving ourselves a little grace through it all. Tone it down a little bit. It's
Right,
okay. It's okay
right.
if you're feeling like this, for
And
sure.
it's very normal.
Totally normal.
Yes.
So normalizing it for ourselves, but also for our kids
Hmm.
too. If there was one takeaway, one thing that we should leave here with today, what would that be?
So, the one takeaway I would say about seasonal affective disorder is that it's common. It's important to pay attention to your own body, your children's mood, behavior. And if you see a shift, be proactive on it. If you see that your child is seeming depressed, ask them about it. And it may just be something small, a simple adjustment in diet or getting some sunlight or some vitamin D or something very small, but really be proactive because with the winter in Maine being so long and so dark, it only has the likelihood of getting
Mm.
potentially worse if you don't sort of jump on it. So I would just say notice it and start those home remedies and pay attention to it.
Awesome. Rebecca, Thank you so much. Certainly appreciate it. And of course, for more resources, log on to our website. That's wgme.com/raisingme. Always a pleasure.
Thank you so much.
As always, so grateful for Rebecca for her insight. And this is one of those episodes that I went home and I took immediate action. Remembering that, I don't know, many years ago, we purchased one of those sun lamps. I dug that out of the way back of a closet, dusted it off, and brought it to work with me the next day. I actually use it every day. As Rebecca talked about, it's just those small preventative things that can really make a big impact. I don't know about you, but really this time of year, there are days I don't see much sunlight at all with the early sunset, late sunrise, and then being at work most of the day. It's not great, actually. I even went home and dazzled the family with my newfound knowledge of the melatonin and serotonin impact on our bodies. They didn't seem all that impressed. However, I really found that fascinating. The other takeaway for me is I just really thought that SAD was more of a winter issue. But no, as Rebecca explained, it can happen any time of year with just seasonal changes. So it is looking out for those signs, the increased sleep, the moodiness, withdrawal, always tired, and just doing the things that we can do at home, better diet, work in some exercise, and super important, just really normalizing the conversation and feelings around SAD and depression in general. Ultimately, knowing that help is out there. Thank you so much for listening to Raising Me and to a sponsor, MaineHealth, for their support. I'm Adrienne Stein. This episode is edited by Megan Littlefield and produced with Nate Eldridge. Please follow Raising Me wherever you get your podcasts and consider a positive rating and review so others can find the message as well. Wherever you are, I hope you learned something new and get to take a little time for you.